Paraphilias are emotional disorders defined as sexually arousing fantasies, urges, behaviors that are recurrent, intense, and spanning for a prolonged period over more than 6 months. It is estimated that 1 to 6% of Australian men suffer from this specific condition. In comparison, women make up 1% of the before-mentioned group.
Clinical presentations are the physical signs or symptoms associated with or caused by a disease or disorder. The clinical presentations of paraphilia are very broad and include a wide spectrum of intense sexual urges, fantasies, and behaviors. These urges must be repetitive, obsessive, and cause the person to be unable to fulfill their sexual desires with a person their age and of the opposite gender. There are many paraphilic disorders, but the most common include pedophilia, voyeurism, transvestic disorder, and finally exhibitionism. Pedophilia involves sexually arousing situations involving children 13 years of age or younger. A voyeuristic disorder is when a person gets sexual pleasure through watching an unsuspecting person getting naked or partaking in intercourse. Furthermore, a person with transvestic disorder involves when a person receives intense sexual arousal through cross-dressing and performing acts as if part of the opposite gender. Finally, exhibitionistic disorders include when a person gets arousal from other people viewing their genitals, whether it be in intercourse or not. The majority of people who suffer from paraphilic disorders are males who suffer from multiple disorders as opposed to only a single one. Moreover, these people also commonly suffer from antisocial personality disorder as a result of their sexual urges. Paraphilia also leads to depression and anxiety in people as a result of the negative stigma surrounding their condition. Etiology is the study of the causes or origins of a disorder. The exact etiology of paraphilia is unknown, yet there are numerous aspects of a person's life that are believed to lead towards reasoning behind the disorder. It is theorized that multiple genetic factors can give rise to both paraphilic and pedophilic disorders. Recent studies found that central dopamine, a molecule in the brain heavily linked with human pleasure, mood, and motivation, has a direct link to paraphilia. The same study reveals that increased levels of serotonin and norepinephrine in the urine of people diagnosed with paraphilia. Furthermore, other experts deduce that paraphilic disorders strongly coincide with childhood trauma, including physical, mental, and especially sexual abuse. Moreover, it is also believed that objects or situations that are linked with one's specific paraphilia become sexually arousing for the person when they are often linked to an enjoyable sexual activity. The person suffering from the condition appears to have extreme difficulty in developing personal and sexual relationships with other people.
Paraphilic disorders occur in a wide variety, ranging from pedophilia, arousal based upon adolescence, to transvestic, arousal based upon cross-dressing. In accordance to the DSM-V, a positive diagnosis of a paraphilic disorder would include the individual experiencing recurrent, significant sexual arousal by an object of their attraction, that in turn has a significant impact on the patient's day-to-day life, routine, and psychological health. In accordance to the DSM-V, there are dozens of specifically diagnosable paraphilias that can in turn be diagnosed via the same diagnostic techniques. These include pedophilia, voyeuristic, and transvestic disorders. With an open category of paraphilic disorders existing, containing disorders that do not fully meet diagnostic requirements, but may have an uncontrolled sexual impulses that cause enough distress for the sufferer that they are recognized. Examples of such specific paraphilias include necrophilia, coprophilia, and zoophilia. Diagnosis of paraphilias is most commonly a three-step process, with medical professionals routinely performing a medical interview where the physician can further understand the specific patient's disorder, followed by a physical examination accompanied by a thorough routine laboratory test. Paraphilia can be diagnosed by assessing whether the patient exhibits a few simple characteristic symptoms. These symptoms include sweating, heart palpitations, irritability, and feelings of stress. Once an individual has been positively diagnosed with a particular paraphilic disorder, there are multiple recovery techniques that can be implemented by the physician. These techniques include psychological assistance accompanied by psychotherapy, in which the patient is educated on how to recognize and manage signs of their specific disorder. In unison with psychotherapy, the removal of provoking objects, also known as the subject of the paraphilic disorder, and specific medications can aid in the management and recovery of a specific disorder.
Paraphilic disorders are reoccurring, sexually driven, intense fantasies towards inanimate and non-consenting objects/people. These behaviors can usually cause distress and uncomfortable urges for the person with the disorder. There are usually many underlying effects and reasonings for people with certain paraphilic disorders. People with the paraphilic disorder may have an impaired or a non-existent capacity for affectionate, reciprocal, emotional, and sexual intimacy with a consenting partner. Paraphilias are very hard to define. However, there are many other disorders that fall under the broad title of paraphilic disorders, such as pedophilia, necrophilia, voyeurism, fetishism, sexual masochism, etc. A survey study conducted of 1,915 German men aged between 40 to 79 found that 62.4% of those men had experienced one or more types of paraphilic disorders in their lifetime. Although there are many symptoms of this disorder, there are also a few alternatives for treatment of this severe illness. There is obviously several different types of disorders within the broad illness of paraphilia, and all of these underlying disorders have many different treatment and epidemiology options available depending on the disorder. In order to appropriately treat the patient, medical health professionals must conduct or refer the patient to a medical interview, physical examination, and routine laboratory tests concerning the disorder. The medical health care professionals will then look at prior mental health issues and research treatment that is necessary to the specific disorder. Many case studies have been conducted and they show that antidepressants have been the most effective, however, they show many detrimental physical side effects. Treatment of paraphilic sexual disorders usually includes the combination of medication and psychotherapy. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, states that historically, psychotherapy was thought to be effective for the treatment of paraphilias and sexual offending. In the past decade, research has shown the most effective treatment of sexual disorders includes medication, behavioral therapy, social skills training, sex education, cognitive behavioral therapy, and monitoring with polygraph and penile plethysmograph. Epidemiology and management of paraphilic disorders may include psychotherapy, group therapy, marital couple therapy, family therapy, pharmacotherapy, or even rarely surgical interventions. Treatment of these types of disorders are only beneficial if the person with the illness is willing to change and committed to controlling their issues. People that are diagnosed with pedophilia, for example, tend to use a treatment called cognitive behavioral therapy. The focus of this treatment is to help the person recognize and combat rationalizations about his or her behavior, as well as training the person to develop empathy for the victim whilst using techniques to control his or her sexual impulses. It takes around 3 to 10 months for testosterone suppression to reduce in males. It is essential that people with such paraphilic disorders reach out as soon as possible and get help from mental health professionals so that the community can live safely and both parties can benefit from being healthy and happy.